Can you give me information on safer injecting?
Needle and syringe programs have been in existence across Australia for many years and are supported by government policy. There are different types of needle and syringe programs available to people free of charge. There is what's known as primary outlets. Primary outlets, their sole existence is to give and receive injecting equipment to people who inject drugs. There are secondary outlets, which are normally based in places like health centres or at AIDS councils, where needle and syringe programs are add-on services. There are also vending machines that are available at hospitals, and there are outreach services with people either going out on foot or on vans, again to give or to receive injecting equipment from people who inject.
The needle syringe program's primary aim is to reduce bloodborne infections such as HIV, hepatitis B and hepatitis C among injecting drug users. And the way it does that is providing a range of clean injecting equipment to drug users, thereby reducing the need for them to reuse potentially contaminated equipment. They also provide other important opportunities, particularly from a health promotion point of view. They provide access into the healthcare system, so they give the opportunity to run health promotional campaigns, for example, to encourage safe disposal of injecting equipment, also how to prevent important public health issues such as drug overdose. Hepatitis C treatment can be promoted through needle syringe programs. Other forms of drug treatment and rehabilitation can also be promoted through the program, and staff there can actually effect referrals to programs depending on what's appropriate for that particular user at that time.
People have the right to be treated with respect when accessing needle and syringe programs, and by and large needle and syringe programs are actually supported by the police. So people going back and forth from needle and syringe programs shouldn't be in any way hassled by the police and should have free entry back and forth. If people do have problems accessing needle and syringe programs by the police, just have a word with the staff at the needle and syringe program and they'll contact the police to make sure that access is made available.
If there's no needle and syringe programs within your area, you can contact your local alcohol, drug and information service or your local user group, and they should be able to give you information on where to access needle and syringes through pharmacies, accident and emergency departments, vending machines, dispensing machines. They should also be able to give you information on where to dispose of your used injecting equipment.
And in some areas of Australia there still isn't 24-hour coverage for needle and syringe programs. Some people will have to travel quite far to access the needle and syringe program. What we advise people to do is to stock up to make sure that they have enough equipment for those times when maybe they can't get to the NSP, or maybe they're using more than they had planned. It's always best to have too much equipment than not enough.
You don't actually need an appointment to attend a needle and syringe program. You don't have to give your name when you come to a needle and syringe program. You don't have to give your date of birth. They're more than confidential, they're actually anonymous.